Welcome to this tutorial on transitional care management. The information given in this training is correct as of today. The most current information contained in this presentation can be found on the Noridian Medicare website and the CMS website at the links listed on this slide. The concept behind transitional care management, or TCM, is for the provider to oversee the patient transitioning back into their home or community setting after being an inpatient. Patients may need assistance with managing their medical condition after being an inpatient. TCM begins on the date of discharge and continues through the next 29 days for a total of 30 days. Patient management and coordination of services, as needed, for all medical conditions may include community resources for transportation, food delivery, medication, psychosocial needs, and other resources to allow the patient to have activity of daily living support for the full 30-day post-discharge as patients transition back into the community setting. The TCM codes are used when the provider wants to assume responsibility for the patient's post-discharge services to try to prevent the patient from getting readmitted to the hospital. Providers eligible to bill for TCM services includes physicians of all specialties and non-physician practitioners legally authorized by their state licensure, such as a nurse practitioner, physician assistant, clinical nurse specialist, or a clinical nurse midwife. TCM can be used to report patients being discharged from an inpatient acute care hospital, inpatient psychiatric hospital, inpatient rehabilitation facility, long-term care hospital, skilled nursing facility, hospital outpatient observation, or partial hospitalization and partial hospitalization at a community mental health center. The discharge must be to a patient's home, a domiciliary center, nursing facility, or an assisted living center, but not a skilled nursing facility. To bill for TCM services, there are two options to choose from. Only bill one code for the Transitional Care Management episode. The first code for TCM is 99495 and is used when patient's condition is of moderate complexity. Some sort of communication needs to be made within 2 business days of post-discharge, with the first business day after discharge being day 1. This communication is by direct contact, telephone, or electronically with the patient and/or the caregiver. Then a face-to-face visit within 14 calendar days of discharge occurs. The second code is 99496, and that is used when the medical decision-making is of high complexity during the service period. Again, communication must occur by direct contact, telephone, or electronically within 2 business days of discharge, with the first business day after discharge being day 1, and a face-to-face visit needs to occur within 7 calendar days of discharge. These 2 codes are only payable once per patient per discharge, so only one healthcare professional can report a TCM service, and this professional assumes responsibility for all post-discharge services. To bill for these codes, it must be billed using the date of required face-to-face visit on the 7th or 14th calendar day. The date of discharge is counted as day 1. You may submit the claim once the face-to-face visit takes place and won't need to hold the claim until the end of the service period. The face-to-face visit cannot take place on the same day of discharge. If the patient is within a post-operative global period for a procedure billed by the same provider, TCM cannot be billed. To meet the requirement of contact within 2 business days after the patient has been discharged, contact may be attempted by phone, email, or face-to-face. If there have been 2 unsuccessful separate contacts attempted, these dates and times need to be included in the medical record. You may still bill for TCM if meeting the other requirements. CMS recommends to continue attempts to reach the patient. The contact can be made by the billing provider or clinical staff that are able to address any questions or needs from the patient. The face-to-face visit must take place within the 7th or 14th calendar day of discharge and can be done by the physician, but it can also be done by licensed clinical staff under the direction of the physician. The face-to-face visit related to TCM is not billed separately as it is included in the TCM code. The face-to-face visit must include communication with outside agencies and services that the patient can use. Education must be provided to the patient to support self-management and help get back to activities of daily living. The provider must also assess and support the treatment regimen, identify any available community resources the patient can be involved in, and lastly, assist the patient and family in accessing the care and services that might be needed. They must also perform medication reconciliation on or before the face-to-face visit. For the non-face-to-face TCM activity, providers or their clinical staff may perform medically necessary services during the 30-day period. Here is a list of items that may be involved in the non-face-to-face service. Obtain and review any discharge information given to the patient. Review any need for follow-up diagnostic tests or treatments. Interact with other healthcare professionals involved in the patient's aftercare. Provide education to the patient, family members, or caregivers. Establish referrals and arrange community resources that the patient can be involved in to regain activities of daily living. Assist in scheduling the follow-up visit to the physician. Auxiliary staff can communicate with the patient or agencies, assess and support medication management, help the patient and family access needed care and services. This can all be done by clinical or auxiliary staff in the same office and not necessarily by the billing provider. It isn't just a call to ask how the patient is doing and to make the next visit appointment, so although it doesn't need to be the physician, it must be someone that can do all of the things listed here. We've been asked if a medical assistant or a registered nurse, RN, can make this call. First, it has to be within their scope of work, and secondly, can they really perform everything that's listed here, like review need for diagnostic tests and treatment? As far as medical decision-making, the patient would require moderate or high level for the current medical and psychosocial needs. Providers need to consider the following factors: the number of possible diagnoses being dealt with, number of management options, the amount and complexity of the medical record documentation, and the risk of significant complications, morbidity, or mortality. Medical decision is essentially like any other E&M visit. The documentation must show the date of discharge, the dates of the interactive contact, the date of the face-to-face visit, which will be the date of service for TCM, and documentation of the complexity of the medical decision-making. Meeting the activity listed here will allow a claim to be filed for TCM services. The place of service is where the face-to-face visit took place. Although CMS says that TCM can be billed as soon as the 7th or 14th day visit is made, Noridian recommends waiting until after the 30 days has passed. And here's why. If the patient is readmitted within the 30-day period, TCM services can still be reported as long as the services described by the code are furnished by the practitioner during the 30-day period, including the time following the second discharge. Alternatively, the practitioner can bill for TCM services following the second discharge for a full 30-day period as long as no other provider bills the service for the first discharge. CPT guidance for TCM services states that only one individual may report TCM services and only once per patient within 30 days of discharge. Another TCM may not be reported by the same individual or group for any subsequent discharge within 30 days. If the face-to-face visit wasn't done before the readmission, then it doesn't count. Hospital visits cannot count as the face-to-face visit. If the patient dies during the 30-day period, the TCM service cannot be billed because the 30-day requirement was not met. Any face-to-face visits can be billed, but now using an E&M visit code. If TCM codes are being billed, the following may be billed concurrently if medically necessary: chronic care management, anticoagulation management, end-stage renal disease (ESRD) services, home health, and hospice care plan oversight. CMS provides a couple of resources on TCM, including an MLN booklet and frequently asked questions on their website. Thank you for taking the time to listen to our tutorial. Continue your learning experience by referring to additional recordings available on the Noridian website or YouTube channel.